Kia ora from Dunedin, New Zealand. My name is Emily Gray and I'm a lecturer at the School of Physiotherapy at the University of Otago and co-author of our paper, which is titled Perceived Facilitators of Physical Activity Following Coronary Artery Bypass Graft Surgery, a qualitative study. We wanted to find out what helps people engage in physical activity during the initial months after CABG surgery, because we know both clinically and from previous research that engagement in activity during the early recovery period can be challenging due to many physical and psychological barriers. And because access to outpatient cardiac rehabilitation is not always possible, many people have to self-manage their engagement in activity after they leave hospital without the support of a health professional. So it is important that as health professionals, we make the most of our interactions with patients prior to hospital discharge and use evidence-based and theoretically informed strategies when preparing patients to engage in physical activity at home. In this study, we interviewed 22 people about their experience of returning to physical activity after their CABG surgery. When analysing the interview data, we applied behaviour theory to identify facilitators for physical activity during the early recovery period. The theoretical frameworks selected were the COMBI model and the theoretical domains framework, both of which were developed by Susan Mickey and colleagues. The COMBI model proposes that for any behaviour to occur, the person must have the required capability, opportunity, and motivation. The TDF comprises 14 domains that fall under these three core elements and thus can be used alongside the COMBI model to perform a detailed behavioural analysis. From our analysis, we identified facilitating strategies relating to 13 of the 14 TDF domains, which covered all three COMBI elements. The most prevalent facilitators identified related to psychological capability, reflective motivation, and social opportunity. For psychological capability, having the required knowledge was really important. And while participants appreciated the information they received about activity prior to discharge, they described some gaps in what they were told. For example, how to safely engage in other types of exercise apart from walking, such as cycling, swimming, and also resistance exercise to help restore their strength. Psychological capability was also enhanced by using strategies such as listening to their body, activity modification, activity planning, reflecting on progress, and problem solving to overcome physical and psychological barriers. Facilitators for reflective motivation included setting meaningful goals and reflecting on positive physical and psychological benefits from activity. A positive attitude, perseverance, and determination, which considered necessary to help overcome the various challenges that they faced. In terms of social opportunity, having support from family, health professionals, and peers was highly valued by participants. Family provided physical assistance with daily activities, companionship when walking outdoors until confidence increased, and much needed encouragement. Those able to attend outpatient cardiac rehabilitation really appreciated the guidance and reassurance provided by health professionals, as well as the opportunity to talk with others about their recovery experiences. The findings from this study identify potential opportunities to optimise the way that health professionals prepare and support patients to engage in physical activity after cardiac surgery. For example, informing people of the physical and psychological barriers they're likely to face is important to provide people with realistic expectations and prepare them for the need to problem solve, plan, and persevere during their recovery. The findings also highlight the importance of ongoing support and challenges us to continue to find novel and sustainable ways to provide outpatient cardiac rehabilitation to ensure equitable access to follow-up support. Thank you for listening. If you have any questions, please contact us on the email address listed on the manuscript.